Today's chiropractic tip, pediatrics. Children have spines too and can benefit from chiropractic care. The procedures used on children are different than those used on adults. However, if you're looking for a safe, natural, and drugless addition to your current healthcare for your child, consider chiropractic. It may be just what the doctor ordered. I'm Dr. Donald DeFabio, reminding you chiropractic is more than just back pain. Hi, I'm Dr. Donald DeFabio, and welcome to The Natural Way to Better Health and Wellness. Chiropractic doctors have specialties like other healthcare professions, and one of the specialties is your chiropractic sports doctor. Now, they are different, and we're going to take a moment to talk to one of our local sports chiropractic doctors to explain what a chiropractic sports doctor is, how it's different from a regular chiropractic doctor, and some of the common conditions that they treat. My guest today is Dr. Greg Duerr, a certified chiropractic sports physician. Dr. Duerr, thanks for coming out today.
Pleasure.
Good question. What is a chiropractic sports doctor?
Well, a chiropractic sports doctor is similar in degree to a chiropractor.
So they're a licensed doctor of chiropractic.
Absolutely.
All right.
Both are musculoskeletal specialists. Both are neuromuscular specialists.
He's dealing with nerves, joints, and muscles.
But what a sports chiropractor is somebody who's usually, now it's not a requirement, but most sports chiropractors go through further certifications. The first level of a certification for a sports chiropractor is a CCSP, a Certified Chiropractic Sports Physician.
And that's an educational program.
Absolutely.
All right.
It requires an extra 100 hours of education. It's usually done in weekend seminars, and it also is followed by a comprehensive national examination that has to be passed in order to get your CCSP.
Okay, and then beyond that?
There's a Diplomate program, which is an extra 200 hours past your CCSP, so 300 in total.
So a chiropractic sports specialist is going to have additional training.
Absolutely.
Why would somebody choose a chiropractic sports doctor?
Well, a chiropractic sports doctor will very frequently look at, as chiropractors do, the whole body, but they are very specialized skills in other types of procedures, like soft tissue.
Well, what do you mean soft tissue?
Soft tissue...
so the palate? You mean sticking the throat? I mean soft tissue.
It's everything like your muscles, your ligaments. The fascia, which is a very critical, fascia is actually the coverings of all those structures, your muscles, your ligaments, and also nerves are considered soft tissue.
All right, so they work a little bit more with the muscles and the ligaments, not just the bones.
Absolutely.
And of course, they're going to work a little bit more with non-spinal areas too.
Yes, sports chiropractors very frequently be treating a lot of extremity injuries, which are very frequent injuries that you'll see on the fields.
Okay.
Whether you're a soccer player, a basketball player, you play football, fencing, whatever your sport might be, very frequently a lot of the injuries associated with these events are extremity injuries, meaning your legs or your arms.
All right, so their sports chiropractic doctors got additional training. They're going to be more adept in dealing with shoulders, knees, hips, ankles.
Both in evaluation and treatment.
That's key. I like that. And we're going to talk about different evaluation and treatments for both a shoulder and a knee today. And that's really exciting, how a sports doc is going to look at it a little bit differently. But one question I have before we start with the knee is, everybody says they treat sports injuries. How does one of the viewers know that they have a qualified doc and it's a good sports doc?
Well, I think one of the important things is, first of all, as we've already mentioned, it's the education.
Ask,
have they completed a CCSP? Have they completed a Diplomate course? What are their other continuing educations? Have they taken some of these soft tissue classes? Have they taken taping classes? Have they done other rehab classes? Those are really where the qualifications come from. Now, that also being said, it's also important, do they have any practical experience? Do they work sidelines?
Yeah.
Do they work with a team? Have they worked events before? Have they been part of the sports medicine team? Because not only is that to the benefit of the patient in their knowledge of and ability to treat, but it also means if they worked on a sports medicine team, they're also used to working with the patient's medical doctor, the patient's physical therapist.
So do they walk the walk?
Absolutely.
So a qualified sports doc is going to walk the walk, and as a patient, a consumer, one of our viewers need to ask those questions of their doc.
Yes.
Sounds good. We are now going to demonstrate the treatment of a knee. We're going to see some soft tissue treatment, Graston. We're going to see some taping, functional taping, and some exercises for the knee. We're also going to see the shoulder, and we got a lot on tap. Dr. Greg Duer is my guest. I'm Dr. Donald DeFabio. We'll be right back with some knee rehab.